Hi everyone, welcome to Heart Health Matters, a podcast series brought to you by the Chair of Preventive Cardiology of the Maharashtra Institute of Health Sciences, powered by Madhabag Institute of Preventive Cardiology. I am Dr. Aman Kapoor and I welcome you all to this feast of knowledge that is relevant for today's world. The Chair of Preventive Cardiology of the MUHS intends to provide you with the latest information on cardiac health, cardiac diseases, how to prevent them, and how to keep your heart healthy. We assure you authenticity stamp on the contents. We shall be sharing with you our expertise, helping you navigate through the complexities of heart health and providing practical tips for preventing heart disease. With each podcast, we'll be covering different topics like risk factors, symptoms, lifestyle changes, and treatment options. If you are looking to learn about how to keep your heart and your loved one's heart healthy, then you have come to the right place. Sit up, focus, and get the gems from the experts of MUHS and MIPC.
Coronary artery is artery of the heart. Three main coronary arteries and their sub-branches form a network of medium-sized vessels on the surface of the heart. The heart is roughly of the size and shape of our fist. On the back of our fist, we have these veins carrying blood. One can imagine the same about coronary arteries. Developing cholesterol or fat-laden blockages in the wall of the arteries is the killer disease, atherosclerosis. Partial clogging of the arteries up to 70% or so causes angina, chest pain, discomfort on exertion. But total occlusion or closure of the artery leads to the damage of the heart and popularly known as heart attack. It stands to reason that to investigate cholesterol buildup in the coronary arteries or to rule out or to estimate the extent of the blockage, some form of imaging will be required. That means one needs to look inside the coronary arteries. The final test, the acid test, or the gold standard for this diagnosis is to have a photograph of these coronary arteries from inside. This highly sophisticated photograph is known as the coronary angiography. Coronary is self-explanatory, angio is artery, and graphy is a photograph. So graphy or gram would remain the same, whether you call it coronary angiography or coronary angiogram. The coronary arteries carry pure blood to the heart itself. Just as all other organs depend on oxygen-rich blood and nutrients for their functioning, heart also depends on this pure blood. The analogy is that of a cashier in the bank. This person receives money, doles out money, as a part of his or her job. Despite being surrounded by money, this person must receive its own salary for doing that job. Heart receives impure blood on the right-hand side, pumps blood into the lungs. Lungs purify the blood, and it is received on the left side of the heart. The left lower chamber or the left ventricle pumps out this purified blood into the whole body. But like the cashier's salary, heart itself must get its own blood supply of pure blood. Purified blood leaves the heart into the aorta. The first two branches of aorta, right at its origin, are the coronary arteries. In fact, they travel back to the heart and spread on the surface of the heart. The left main divides into two called LAD and LCX, and the right stands alone. So these three major branches will have smaller branches, tributaries, and capillaries which ramify inside the heart muscle. If one wants to study the blockages, a photograph of the heart from outside is of no use. What we need to have is a pipeline visualized. The bore or lumen of the coronary arteries should be visualized, and this test is known as the coronary angiography. The current best-in-world technology can visualize the bore or lumen of the artery by X-rays or by CT scan. In both these methods, blood inside the coronary arteries is made opaque so that the flow can be studied. An iodine-rich dye or contrast medium, which is inert and safe, needs to be introduced inside the arteries. So it flows through the blood and pictures can be taken. The gold standard or invasive catheter angiography is performed in a special room called the cath lab. This area is sterile like an operation theatre. The cath table can be moved in 4 directions. It is fitted with a C-shaped arm of X-rays. The X-rays pass through the body of the patient and are captured on the other side by the image intensifier. A highly sophisticated software generates a video of 10 to 12 seconds. This detects the flow or shows us the arteries and its branches. But X-rays cannot detect blood unless the blood is made radio-opaque. A long tube or a catheter for this is passed up the arterial tree to reach the base of the aorta. Artery of the wrist, the radial artery, or the groin, the femoral artery, are just under the skin and can be felt pulsating. Either of these areas is made sterile by antiseptic solution. A local anesthetic is infiltrated, and a tiny needle pricks the artery and the blood spurts out. A cannula or a short tube is inserted in place in a fairly painless manner. Through this cannula, a long thin tube, the catheter, is passed up the artery against the bloodstream. This travel, however, is quick, painless and effortless. The catheter, especially the tip of it, is observed by the X-ray control. For the right and left coronary artery, the tips of the catheters are shaped differently. The catheter is designed in such a way that it enters the origin of the respective arteries. It sits there a few millimeters inside the origin of the artery. Having secured this position, iodine-rich contrast is injected in the catheter. As it travels through the coronary artery, making it radio-opaque, a video is recorded. We do that about 6 to 8 times in various angles and views to get the complete information. This done, the catheter and the cannula are removed. Being an artery, it requires compression at the exit point for about 15 to 20 minutes. A pressure bandage is then applied to that area. The patient is observed in the wards for about 6 hours and discharged the same day. The actual procedure is about 15 to 20 minutes with a hospitalization of about 8 hours. Cost of the procedure in 2023 is about 15,000 to 30,000 based on the type of machine and the room that you enter. Coronary angiography tells us presence or absence of blockages. It tells us about percentage narrowings and the location of the narrowing. That is, whether it is right at the origin or midstream or downstream, whether it is in the main branches or in side branches. The accuracy of this method is almost 100%. Two observers can differ in their appreciation of the percentage narrowing by a maximum of 10%. The percentage narrowing is not automatic or computerized. It is by human observations. In less than 3% population, there could be abnormalities of the origin of the arteries. They could arise from a different location altogether. Sometimes a disease causes them to balloon up, that's called ectasia. Sometimes the arteries are narrowed down or they temporarily narrow, that is called as a muscle bridge. During training as a cardiologist, the earliest procedure that is taught is the coronary angiography. This shows us how easy the procedure has become over a period of time. It can be done in acute heart attack, it can be done at all age groups, it can be done years after a bypass surgery. Angiography divides the patient into 3 groups. Mild or no disease. It requires only small medication or nothing at all. Few main arteries with more than 75% blockages go for angioplasty or stent implantations. Many arteries blocked and percentage narrowing is more than 75%. A severe disease would go for open heart surgery like a bypass surgery. Angiography of coronaries is almost 60 years old technique and now it's absolutely refined and practically perfected. Less than 3% complications can take place. At the site where the puncture is made, there could be a little swelling or pain or bleeding. Contrast medium can sometimes cause allergies sometimes can affect the kidneys. But by and large, it's a very safe procedure. CT scan visualization of coronaries non-invasively is also a method of coronary angiography, but that's a different subject of discussion. Because conventional catheter angio is invasive, it involves X-rays, contrast, hospitalization and expenses. It is reserved as a last test like the Supreme Court, and it's not a routine examination.
Thank you so much for those simplified gems of information about the heart. Thank you to all our listeners for joining and listening to our today's podcast. We hope you found today's episode informative and inspiring. We are here to support you in your endeavor of keeping your heart healthy. We truly care about your heart health and would like to see you succeed and remain healthy. Remember, you have the power to make positive changes in your life, and we are here to help you achieve those goals. So let us all commit to living heart healthy lives together. Thank you for being a part of this community. Until the next time, stay healthy, and before you go, do give us a like. If you have any other questions or comments, please don't hesitate to reach out to us. The link to connect with us is there in the description below. Do share this podcast with your friends and family, and also share it on your social media. Sign up for our newsletters and leave your questions or your comments below. Thank you so much for listening to us. Till the next time, this is Dr. Aman Kapoor. Bye-bye. See you all. Stay healthy, stay fit and fine.